everyone, welcome to our project presentation, Smart Health Alert, a real-time student health monitoring system developed to connect the UiTM Cawangan Pulau Pinang health unit directly to the hospital emergency department. This system is designed to monitor students' health conditions in real time and send out immediate alerts in case of emergencies, helping to save time and also lives. In this video, we will walk you through everything. Our objectives, the methodology of our system, prototype that we built, how we tested it, and also how much it costs. And to guide you visually, here is the poster we have prepared. It gives a complete overview of our project, from the main objective to the how system works, a preview of the prototype, and even a breakdown of a budget. Let's go through each part of it.
How we came up with this project? Actually, this idea came from a real experience during one of our co-curricular activities at UiTM. One of our friends suddenly fainted. When we rushed to the health unit, we realized that the ambulance didn't have proper monitoring equipment, and there was a delay in assessing their condition. That moment made us think, what if we could help our campus health staff by giving them a system to monitor students' vital signs in real time, a system that can act as an early triage tool even before the student arrives at the hospital. So, we asked ourselves, why not develop a solution that allows the UITM health unit to detect emergencies faster, send alerts instantly, and help prioritize students before they go through long hospital registration processes. That is how the Smart Health Alert system was born.
Next, I will explain the problem statement of our project. So first, without the real-time monitoring, it is hard to quickly detect and prioritize student health emergencies. Next, the poor communication between UITM health and hospitals will delay the swift handling of critical student health cases. Lastly is overcrowding in emergency departments. It will prevent the students' health concern from getting the attention what they need.
The objective of the project is to design and develop a real-time monitoring system to continuously track student health metrics for timely detection and prioritization of emergencies. The second objective is to enable seamless communication and data sharing between the unit kesihatan UiTM and the emergency department hospital for rapid prioritization and response to serious health incidents. And finally, to evaluate the effectiveness of the monitoring and communication system in improving emergency response times and prioritization accuracy in healthcare settings. This objective highlights the core principle of our project, which is to streamline, make it more effective, and cut down the time. This is the worst problem that we can see today, the system of the communication between the unit kesihatan UiTM and the hospital. So, in order to gauge the level of student health, there are few parameters that we exact, which is heart or pulse rate, temperature, oxygen saturation, and pupils condition. When considering the heart or pulse rate, the counts the number of heart beats per minute using the fingertip or wrist. As we can see, the normal range is between 60 to 100 beats per minute. For temperature, we measure the temperature using a thermometer on the forehead, ear, or underarm. It is usually normal temperature range between 36.1 Celsius to 37.2 Celsius. For the oxygen saturation, we check the oxygen level in the blood using a fingertip device, and the oxygen saturation level consider normal range between the 95% to 100%. Finally, we check the pupil conditions, use a flashlight to check pupil size and shape for head injury signs. The pupil conditions of a normal range in 2 mm to 3 mm in diameter and also in round shape.
So this is the schematic diagram of the project. So it represents the hardware setup for our IoT-based real-time student health monitoring system. So the goal of this project is to enable continuous health tracking of students and ensure timely medical response in case of emergencies. So at the core of the system, we have the ESP32 microcontroller, which acts as the brain of the entire setup. So it is chosen for its built-in Wi-Fi capabilities, low power consumption, and flexibility in handling multiple inputs and output. So the two primary health sensors are connected to the SP32, which is the first one is the MAX 30100. So this is responsible for measuring heart rate and blood oxygen saturation, which is SpO2. So these are the critical indicator of a person's cardiovascular and respiratory health. Next is the MLX 90614 infrared sensor that measures body temperature without the need of direct contact. So this is actually useful for hygienic, non-invasive temperature monitoring. And these sensors are connected using the IC2 communication protocol, which share line for the data SDA and the clock SAL, so helping to reduce the number of required pins and keeping the design compact and efficient. Next, for the interaction, a push button is included, which allow the user to manually trigger the health check or send an emergency alert if they are feeling unwell. And this start button is start as the if the user want to start the process. Next, we also have the 1x4 membrane keypad that allow for user input. And we also have the OLED display to use to present a real-time data reading such as the student temperature, heart rate, and SpO2 level. So this immediate feedback is important for both student and the medical staff on site. Next, we also have the LED indicator that connected through the 220 ohm resistor. So this one will light up to show a status changes or when a reading is in progress or when the alert has been triggered. So this schematic diagram enables a remote real-time monitoring by healthcare professional at both Unit Kesihatan UiTM and the hospital emergency department, ensuring a quick medical response. So this system serves as a proactive step towards student health safety, allowing early detection of potential health issue and ensuring that a medical help is alerted without delay.
Before we even started building the prototype or designing the schematic diagram, we first focused on choosing the right components, both in terms of function and cost. Since this project is based on real-time health monitoring, we chose the ESP32 microcontroller as our main microcontroller because it supports Wi-Fi and Bluetooth, which is perfect for IoT applications. To measure heart rate and oxygen level, we used the MLX 30100 sensor. For body temperature, we went with the MLX 90614 sensor, which is the contactless sensor, which makes it more hygienic and comfortable for the students. We also added a keypad, so the staff in the ambulance or health unit can quickly assign the students' pupil conditions. For example, pressing 1 for the normal condition of the pupils and number 2 for the abnormal conditions. Next, an LCD display we plan to place on top of the prototype to show live readings, and LED is used for visual alerts. A push button is also included for manual control or to reset the system if needed. During the early stages, we use a breadboard kit to test the circuit, then move everything to a PCB board later for a cleaner and more stable setup. Header pins were used to connect the modules, and resistors were added to make sure the components are protected. Lastly, we included a pen medical torch, which is used to check the student's pupil reaction. A quick and simple check that can say a lot of things in an emergency. We also took the cost into account throughout this process. While we started with a basic budget, some sensors didn't work out and had to be replaced, so the final cost was slightly adjusted. So you all can see the details in our costing table. We chose Arduino IDE and AWS IoT for this project after comparing several other platforms, both for coding and cloud connectivity. For coding, Arduino IDE stood out because it's lightweight, easy to use, and widely supported, especially when working with ESP32. Arduino IDE was more straightforward for our team. With Arduino, we had access to a large community, lots of ready-made libraries, and faster debugging, which made development much smoother. For the IoT platform, we went with Amazon Service provide AWS IoT platform because it offers reliable, secure, and scalable cloud service. We cooperated with alternatives like Blink, Firebase, and ThingsBoard. Blink is good for beginners and has a great mobile interface, but it's more limited in terms of long-term data management and cloud security. Firebase is better for apps but less suited for device-to-cloud communication in real-time using protocols like MQTT. ThingsBoard is very customizable but can be heavy and hard to manage. In the end, AWS IoT gave us the best balance, which is real-time communication using MQTT, strong security features, and integration with other AWS services if you want to scale up in the future. So, combining Arduino IDE with AWS IoT gave us a reliable and feature-proof solution for building our real-time student health monitoring system.
So now we want to demonstrate our prototype and our system. We have series environment discrete and endurance. So this is a question. First, we have to equip question with our heart rate and SPO2 sensor. This sensor will be equipped at the fingertip to detect the heart rate, which is the beat per minute, and also the oxygen saturation in the blood. First, the system is off. So now, before we start taking reading from the patient, we have to start the system by pressing the push button. As you can see, now the system is on. This is the indicator that the system is on. So the next step is we have to enter the pupil condition. Okay, after we equip the patient with this sensor, we have to use this temperature sensor at the forehead, which is really close to the forehead, like 3 to 5 cm to get accurate readings. So here we can see the display at the LCD output for the pupils, for the temperature, and also the oxygen saturation. Okay, we're taking the measurement and readings from the patient for their heart rates, oxygen saturation, and also temperature. This data will be directly sent into IoT cloud. We are using AWS IoT Cloud, which is the service from Amazon. We send the data every 10 seconds. In this display also, we initialize the alert for each vital signs so that the emergency hospital department will alert by the readings of the vital signs from the patient. In this case, for this patient's vital signs, this category has been under yellow case. So, to indicate the medical assistant in the ambulance, we assemble it through the LED that says it is in yellow case.
So after we visualize the data in IoT AWS, we also send the data from the S3 bucket. S3 bucket is the service from AWS also, which store the data from the AWS IoT platform, and then from the S3 bucket it will extract the information in the data. And I have created the HTML, which is the WebSocket using the API from the Amazon itself. And this is a dashboard to visualize the vital signs and the student data health from the ambulance. I can say that AWS is a really great IoT platform because it really integrate with the real-time data so fast, and it doesn't have delay between with the data received from the IoT platform. As you can see, the dashboard also receive every 10-second data from the IoT, and IoT also receive the data that we have been initialized in our coding for every 10 seconds. As you can see, the text will show the alert message for the medical assistant at the emergency department to see how is the condition of the patient during on their way to the emergency department in the ambulance.